Hello and welcome. You're watching India Fights Back with me, Rajat Kain. Well, as numbers continues to rise across country of COVID-19 positive patients, authorities are ramping up vaccination drive. Now, from April 11th onward, COVID-19 vaccination session may be organized at workplaces which are having about 100 eligible or more willing beneficiaries to facilitate the optimal utilization of vaccine dosage and also important, reduce wastage of COVID-19 vaccination. Organizing vaccination workplace will not only be convenient to staff at workplaces but also help to avoid travel and hence reducing the risk of exposure to COVID-19 virus, which is really important in terms of the rising number of cases. And of course, people are getting conscious about it. At the same time, there is small restrictions in some parts of the country as well. So on the front of vaccination drive, the center said it's supplying vaccines to all the states equitably. Well, how important is it, therefore, to take into consideration the vaccination and, of course, like all the eligible beneficiary to go for vaccination drive, as this, along with COVID appropriate behavior, is highly essential so as to keep this pandemic or at personal level, this disease at bay. To discuss further on this issue, we joined a panel of two guests, Urvashi Prasad, Public Policy Specialist from NITI Aayog. Many thanks, Urvashi, for joining us, and Dr. Samiran Panda, Head of ECD Division, ICMR, New Delhi. Many thanks, Dr. Samiran Panda. Good to have you on the show. Well, let me start with you, Urvashi. As we are nearing the stage of ramping up vaccination drive from April 14th, more and more centers and places and avenues for vaccination will open up besides the hospital and health centers. How important do you think this move is at the outset?
Yes, so it's we are at a very crucial juncture, and as you mentioned that cases have been rising now in quite a few states. It started with one or two states where we saw most of the cases, but it's now been expanding to other states. So we are at a very crucial juncture in this fight against COVID, and we managed the first sort of wave, if we can call it that, fairly well. We need to ensure that we get over this hurdle as well, and that will only happen if we're in this together. So, the center, the states, civil society, citizens. I think that's very important to say at the outset that, it's not one versus the other at this stage. We'll all have to come together. We'll all have to iron out any challenges collectively. So I think in that context, this push that the Prime Minister has given, this additional push over the next few days to say that we should try and vaccinate as many people as we can above the age of 45, giving focus to the high priority districts. This is something that he's also mentioned, and it is something that states must look at as well, that, the districts where they are seeing a particularly rapid rise in cases, those must be prioritized at this stage for this vaccination effort. And of course, if there are any issues, whether it is regarding supplies or any of those are being ironed out, and those have to be worked out in collaboration. That center-state collaboration is more important now, perhaps than ever before. So I think that in that context, this drive is really very, very important. And that's why I mentioned civil society and citizens, because they also have a big role to play in addressing hesitancy, in encouraging more and more people to come forward at this time. So I think all the stakeholders will have to play their role at this time to ensure that we really pick up this pace of vaccination as much as we can.
Right, that's extremely important. Thank you, Urvashi, for your opening remarks. Let me go to Dr. Samiran Panda. Dr. Panda, as I said, the cases, the numbers have been rising, especially in last month or so. Ever since we have hit March, there has been rise in numbers at a phenomenal scale. How important, therefore, is it to actually get vaccinated more and more people on the eligible group? I'll come to the other part of people who perhaps needs to also be vaccinated besides the eligible group and what we are going to do about it or when we'll actually get to see that. But first, let's deal with the eligible group who fit the criteria of 45 plus.
Well, Rajat, this is a very important question. And with regard to the increasing number vis-a-vis the role the vaccine could play, if we want to focus on this, we should also take into cognizance the question which is being raised in different media that despite vaccination, many people are getting infected. So that should also be addressed.
Okay.
So first of all, what does the vaccine do, or what should be our expectations following vaccination? The vaccines which are available in India and globally, that holds true as well. The vaccines against COVID-19 which are being administered are supposed to prevent the advancement of the infection from moderate to severe disease. So it is a disease-modifying vaccine. It's not an infection-preventing vaccine. Why am I trying to stress upon this or underline this particular issue is due to the fact that if vaccinations happen in large numbers, we would expect and we'll get to see finally that the number of deaths averted will go high. Meaning we'll be able to, avoid deaths from happening and the complicated or advanced stage of the disease from happening, which would mean the requirement for oxygen in the hospitals, the requirement of ventilators in the hospitals, and the burden of care on the healthcare system as a whole would get reduced. However, this does not mean that more vaccination would reduce acquisition of infection. So the viruses are spreading because there is a lack in prevention or protective measures that requires to be followed by the larger section of the community who are not yet infected. So the point I'm trying to say is that while we have to, as Urvashi ji said, the vaccine hesitancy need to be addressed and more vaccination need to happen so that there is no wastage of the vaccines. Hand in hand, there should be an attempt of, encouraging people for protective behavior and innovative behavior change communication will have a major role to play there. Because I would like to underline the moment we wear face mask, that starts working immediately. And face mask would prevent acquisition of infection. And what vaccine would do, it would prevent getting into complicated or advanced stage of the disease. So both are equally important.
Right, Dr. Samiran Panda, that's really important that more and more people need to be vaccinated here. Urvashi, there have been reports of some states flagging concern about the low stock. I'm not saying shortage here, but they're flagging the low stock of vaccines. So how important is it for the center to have the supply chain ready and of course to make sure that there is supply across the country of vaccine? I know Union Health Minister and several other union ministers, they have reiterated time and again that there is no shortage of vaccine.
Yes, so, as I mentioned, that this is, of course, a very dynamic situation. And now with, the cases also going up and all of that, the requirements for different states are also changing. And the center is, of course, continually and has to also in the future continually try to respond as quickly to the requests and to the need for additional doses, additional vaccines coming in from different states. So I think that is something that will remain a top priority and also a dynamic situation between, both the center and the states. But the wastage point is also very important because I think this has also been flagged in previous discussions that have happened between the center and the states, also meetings the Prime Minister has chaired, that we also need to put in all possible best efforts to minimize the wastage. Because at the end of the day, we are a very large country. We are talking of a very large number of doses here. So we do need to do our best that at least we are not wasting precious vaccine doses as much as we can. Of course, we understand the issues, the implementation challenges, again, at the kind of scale that we have to do in our country. But best possible efforts do need to be made. And of course, we've also tried to flag to, different states where wastage rates seem to be on the higher side, that they do need to check this. So I think both the center and states will have a very, very important role and a partnership one. I think I'm just stressing on that again and again because we are at a very sort of crucial juncture, and this is not the stage to either point fingers or to do any sort of blame games. But the more we can all come together and work together, the best chance that we have to actually bring an end to this and to actually save as many lives as we can, which as Dr. Panda also said is one of the biggest, perhaps the biggest objective. That it's not just about infections, but it's how many lives you can save, and that's actually the biggest goal of the vaccination program too. So I think that's what I would say on the supply issue.
Right. Absolutely. What's important here is that there should not be any wastage of the vaccine. It's a precious thing. So clearly, there has to be a strategy in place by all the states and the concerned authorities so as to ensure that there is no wastage of the vaccine. Dr. Panda, if we say take a micro picture of the virus and the spread, especially like the second wave as it's been referred to as, we have seen, and there has been some study by ICMR and also like experts have pointed out, the silver lining, I'm just saying it with the caveat here, the silver lining in the second wave happens to be the lower number of demises. Now, at the same time, if we take into consideration the extent at which we have seen the rise of numbers, and it'll hit a peak by next week of April, about 14th to 15th. So, is there a possibility that the coming down of the numbers would be equally sharp as we have seen the rise? Or it will again take a long time to subside down? It took us 5 months when we hit peak in last year in 2020 during September. It took nearly 5 months, and coming to February, we started having figures in the single thousand digit. But now, its picture is fairly different.
Right. So we are talking about a projection, what we could expect in terms of the rising number of infections. Rajat, it is actually an interplay between the biology and the behavior. Both the words start with the letter B, but they work very differently. In terms of biology, in some of the states, we are witnessing that more transmissible viral strains are circulating. Punjab here is the case in consideration. However, that's not the case for all the states. So there, the behavior comes into play. Be it the new strain or be it the older strain, it is spreading in larger number of people because the virus is getting an opportunity to get transmitted from a person who is infected to the larger mass who are susceptible. And if there is an environment created, be it through mass gathering due to social events, marriage or any other things like that, or religious reasons, or even election campaigns, then there would be a chance for spread. So here the expectation whether this peak is going to take a shape as we saw in the first wave or not, this is all dependent on how do we socially and at the individual level behave. Will it allow an opportunity for the virus to spread irrespective of the strain? Secondly, then some of the strains are more transmissible, but not necessarily they are more virulent. So that could be another reason for seeing lesser number of deaths. Third, and the most important now is in terms of vaccination. If more and more people get vaccinated, then there is also an evidence from ICMR research that the vaccines that we have currently, which is being implemented under the program, they do work against some of the newer strains, which is a good news.
Right.
So if more number of people get vaccinated, then they would not allow the virus to proliferate as efficiently as they were able to in case of a non-vaccine situation. And the lesser proliferation happens in the virus, then lesser chance of mutations happening. So I would say three things. One, the prevention measures that we should follow at the individual level. Second, the mass gathering that should be avoided at the social or societal level or community level. And thirdly, as much vaccination as possible, because that would actually prevent the virus from getting mutated. It won't allow the virus to proliferate, and during or through the process of proliferation getting mutated, that chance will also be reduced. So, and death, of course, will be averted at the advanced stage of the disease. That's the advantage of the vaccine.
Right. Dr. Panda, just one more thing before I go off to Urvashi. I just want to pick your thoughts over it. There was ICMR study last week about the reinfection. I know the sample size was fairly small, and even the positive cases of reinfection was very, very small. But then, is it something for future that ICMR or other experts are studying very carefully that, I mean, the cases of reinfection, if that starts rising, then of course, like we have a real problem at hand?
Thank you for raising this question. Yes, we did conduct a study, and we have come up with a definition of reinfection. So reinfection, although rare, is a reality. And one should not assume that a prior infection would provide some kind of immunity to someone against reinfection. So as reinfection is a reality, we would or should remember that although somebody had prior infection, he or she should not take it lightly about the possibility of getting reinfected. And that the same phenomena holds true also post the possibility of post-vaccination infection. So as these are realities, that those have been documented in India, I would say that following infection with COVID-19 or following vaccination, we should strictly observe COVID-appropriate behavior, particularly usage of mask.
That's really important, COVID-appropriate behavior, and that's what the Prime Minister also emphasized, dawai bhi and kadai bhi. That means you have to take vaccination as well as follow COVID-appropriate behavior. Urvashi, is there really a fatigue that is setting in, which is why we are seeing complacency among people? I know it's wrong to blame people, but somewhere down the line we have to balance our lives out as well. We have to continue our work and continue business. There are money constraints, there are financial issues. At the same time, we have to really take care of our health in terms of this pandemic. So how does one balance it out?
Yes, so, of course, pandemic fatigue is something that we're familiar with, and it does happen. It's sort of almost inevitable when you're dealing with a situation for a long period of time. But in India, a few things, happened together. For the last few months, we saw that the cases were consistently coming down. So somewhere, that little bit of sort of laxity can also naturally set in. It's not about blaming anybody, but when you see that, okay, the numbers have really, come down to a minimal, I can sort of pretty much be back to normal life. There is a tendency to start doing that. Then, of course, we had also a lot of festivals, and we saw towards the end of last year, we saw the wedding season. So I think a lot of factors started coming together for us. And eventually, whether it's also different variants, ones which might be more transmissible. So I think it's a bunch of factors which partly might be related to the viral behavior, partly related to people's behavior. But I think, as Dr. Panda said, the best way to protect yourself today, as of this moment, is to continue your COVID appropriate behaviors, whether you have a vaccination or whether you don't. That is really the most short way. And so we must never give up on that. And it's also very important because, sometimes I see these alarmist headlines some places or in social media that, so many people got the vaccination, but they've still got the virus. We must refrain from those, because what it does is that it kind of makes the vaccine seem ineffective, which is not true. The goal of the vaccination, as we've been saying, is to prevent severe disease, to try and prevent hospitalization, and to almost certainly prevent fatalities. So that is really the goal. It's not the goal necessarily to actually cut down on infections. So the moment we put headlines like that, we leave the room for people to misconstrue the role of the vaccine as well as the effectiveness of the vaccine. So I think it's very important to say that vaccination, if you can get it, you must get it, because it will ensure that, even if you do get an infection, it will not be severe in all likelihood. But if you don't have the vaccination, or even if you have it, you must not give up the COVID appropriate behaviors. I think those are the two streams and channels of really our fight against this pandemic, which we have to keep running parallelly. We cannot, give less weightage or more to one or the other. So I think that is very, very important for all of us to remember.
Right. Dr. Panda, as we are starting our program of mass vaccination, especially at workplaces from April 11th, and Prime Minister has requested states for 100% vaccination, at least attempt that, 100% vaccination of 45 plus population. Hypothetically, if we achieve this target, how helpful will be in, looking at a larger picture of herd immunity? This is more of a hypothesis I'm asking. Dr. Panda.
Sure. Clearly, that will be a great achievement in terms of reducing the possibility of advanced stage or complicated stage of the disease or death amongst those who are most vulnerable. So what India is heading towards and is also practicing is actually the proper coinage would be smart vaccination rather than mass vaccination. Why do I call it smart vaccination? Because you see, India very consciously prioritized certain groups. So naturally, by vaccinating 60 and above, it tried to address the needs of the people who are at the greatest risk of dying or having advanced stage of the disease. But even before that, India did something which is very ethical. The healthcare professionals and the frontline workers, due to their occupational nature and standing, had the possibility of getting infected. So they were prioritized first, then came the group of 60 and above, and then there was a consideration about those who have comorbidities. And now, slowly, as the social life and activities are trying to get back to normalcy, naturally, young adults will go out and their chance of getting infected would rise. And so, although they get infected, we should see that they do not land up in severe form of the disease. And that's why 45 and above, irrespective of whatever the health condition they are in. So these are really smart steps. And if 80%, I am not even saying 100%, if 80% of all these population groups get vaccinated, we will see a drastic effect or impact of this vaccination program, which will do two things. One, the burden of the disease on the healthcare system for care would drastically get reduced. And secondly, we will also see the mutants not happening. Parallelly, as Urvashi ji said, if we observe a COVID-appropriate behavior, we'll also be able to break the chain of transmission of the virus. So there will be three things happening if we can really achieve a fantastic coverage, 80 to 100% in the prioritized groups. So here again, we are talking about groups which have been brought under the ambit of the vaccination program, and removing the hesitancy there, not adding to the confusion at all, and unnecessary panic buttons need not be pressed through wrong reporting or information dissemination, and we will be able to then win over this, the fight against COVID-19 in the country.
Well, that's really important. So all these things combined with the COVID-appropriate behavior, and of course, like vaccination for the eligible group, at the same time, taking into consideration that vaccination or vaccines should not be there to be wasted. Well, we end up on this note, but before we leave, first, many thanks to Urvashi Prasad, Public Policy Specialist, NITI Aayog, for joining us, and Dr. Samiran Panda. Many thanks for joining us from ICMR. And that's what the expert says, which is what is our appeal to all our viewers. Please follow COVID-appropriate behavior and do not listen to hearsay. Here is a small appeal to all our viewers. Well, keep wearing a face mask, keep washing your hands, and do not forget to maintain social distancing. Remember, these are small things that can help us in defeating this pandemic. Well, that's it in this edition of India Fights Back. Thank you and goodbye.